Yeah.
Call I'd like to call the January meeting of the County Legislature Telephone meeting to order. Brandon, could you take the roll?
Sure thing, Mr. Chair. Joyce?
Present.
Miller?
Present.
Ward?
Present.
Collins?
Here.
Lockhart?
Here.
Hoffman? Robinson? And Bethany and Clay are excused by the president.
Thank you, Brandon. Okay, under the agenda, under previous business, can we get a motion to approve the previous meeting minutes? Motion made by Mr. Miller,
Second.
second by Mr. Word, all in favor?
Aye.
Any opposed? Unanimous. Under current business, for the Legislative Department of Health, number 2, amending resolution number 94 for 2023, as amended regarding the National Diabetes Prevention Program. And today we have Mr. Ransom Ward, Director of Finance, right?
Hi. Good evening. This is a simple request. Our 2019 Blue Fund grant from the Blue Cross Blue Shield Northeastern New York. We're just asking for a one-year extension until the end of 2024. We've already gotten the approval from the grantor and are requesting the ledge to second that approval so that we can move forward with the work of the grant.
Any questions from the committee?
I just had a question on the RLA. It says it's 100% local,
Yeah.
but then it says it's a New York State pass-through, so are we reimburse? Is it?
Sorry, I want to make sure I'm not missing something that we can
It's in the RLA.
Yeah.
Everybody fact check it.
Oh, the New York State Pass-Through Agency, that's a placeholder in there that you're supposed to fill out. That's always there. There's nothing typed in there.
Okay.
But Blue Shield of Northeastern New York, 100% local, that basically, it's a other source of funds, not the county, state, or federal.
Oh, okay, that's all you need. Thank you.
Mr. Ward, Mr. Miller?
Yeah, so obviously there's a letter in there from the grantees, sort of saying, hey, this is really longer than it should, even with everything going on. So can you sort of elaborate a little bit on that? You don't go too far on it. And then really, what's the plan to make sure the funds do get spent in this year?
Sure. So it was a little difficult with the pandemic to, obviously, I'm not going to go through chapter and verse with that. But as far as progress, there was an issue because there are fewer providers for this program in the area. The team has been able to identify 3 vendors that we're working with to hold these classes. That's all happened since, in 2023. They also were able to train over 10 people. They hired a trainer to train people to get certified in this, which includes 6 Department of Health staff. And they are also, moving forward with this. It was just taking some time, with approvals and also the contract process with the vendors. One of the vendors that we've engaged is Lincoln Pharmacy, and they were recently certified. Their process took a little time to get certified, and then we engaged with them.
And it was like $150,000 total, I think, right?
Yeah.
And how much is, what?
I think there was approximately 50,000 spent so far. Let's see.
But you think you guys will be able, we were talking about this on Tuesday night too. It's like, when we get this money, we want to try to make sure we can spend it and get it to
Right.
people.
Right.
Do you think that plan you have now will be able to get us to expend that?
I think so. The 3 vendors total $45,000. So if you add that to the approximately 50 that's already there, then you're 95, close to 100, and then an additional 50,000. I think that they plan to spend it. Oh, okay. There was some promotional advertising costs that they also spend to plan for. That's about $22,000. So we're getting close to 150 just with those calculations. So I'm pretty confident that they're able to spend the majority, if not all, of the funds of the grant.
I appreciate it. We just want to make sure these things get it to the people as much as we can.
Yep.
Thank you, Mr. Miller. Any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Ward, second by Mrs. Lockhart, all in favor?
Aye.
Any opposed? Unanimous. Okay, number 3, amending resolution number 92 for 2023 as amended regarding COVID-19 funding and amending the 2024 Department of Health budget.
This is a request to accept $1.25 million of additional funding. It's related to a COVID ELC grant that the department currently has. The original end date for this grant was December 31st, 2023. We were notified towards the end of 2023 that there was additional funding, and they were extending the term until July 31st of 2024. So that's the request.
Mr. Moore, any questions from the committee? Any Question? No. Motion made by Mr. Miller, seconded by Mr. Collins. All in favor?
Aye.
Any opposed? Thank you, and thank you, Mr. Moore.
Great, thanks.
Okay, we'll move on now to the Department of Mental Health with Dr. Giordano. Number 4, authorizing an agreement with Information Management Associates regarding patient billing software at the Department of Mental Health.
Good evening, Mr. Chairman, committee members. I'm here with my fiscal director, Michael Fitzgerald. We're here to get approval, hopefully, to renew a contract with the vendor who has been responsible for our electronic health record, actually for the last 30-plus years. And it's an annual contract renewal that we're asking you to review and hopefully support.
Thank you, Doctor. Any questions from the committee? Hearing none, can we get a motion?
I'll make the
Motion
motion.
by Mr. Ward, second by Mr. Miller. All in favor?
Aye.
Any opposed? Thank you.
Appreciate it as always. Thank you.
Thank you. That's it. Can we get a motion to adjourn? Mr. Miller, second by Mr. Collins. All in favor?
Aye.
That was easy.